1 million lives lost to the coronavirus. That's the milestone the world has now passed. What emerged from a market in Wuhan has affected every single part of the planet. And with no end in sight to this crisis, where do we go from here? This is Inside Story. Hello, I'm Hashem Ahelbarra. Welcome to the program. 1 million deaths and counting from COVID-19. It's a milestone nobody wanted to see. In efforts to stem the spread, economies have been crippled around the world, and still it continues. There's a resurgence of infections in Europe, with restrictions being put back in place. Yet the deaths mount up. As you can see from the Johns Hopkins University tracker, thousands more lives have been lost, and there are more than 33 million recorded infections. The World Health Organization is warning the number of dead could double to 2 million before an effective vaccine is widely available. The United Nations Secretary General Antonio Guterres is calling on the world to unite and not lose hope.
Our world has reached an agonizing milestone, the loss of 1 million lives from the COVID-19 pandemic. It's a mind-numbing figure. Yet we must never lose sight of each and every individual life. They were fathers and mothers, wives and husbands, brothers and sisters, friends and colleagues. The pain has been multiplied by the savageness of this disease. Risks of infection kept families from bedsides, and the process of mourning and celebrating a life was often made impossible.
The pandemic has changed the world, but some places are worse affected than others. The US, Brazil and India account for more than half of the infections and nearly half of all deaths. With more than 7 million cases and 205,000 fatalities, the United States is the worst hit. India is second in the number of infections, but has a relatively low death rate given the size of its population. Europe is bracing for a second wave as winter approaches, with lockdowns being reimposed in some countries. And on the African continent, South Africa has been worst affected, but infections have dropped there recently. Let's bring in our guest. In Stowe, in the US, Bob Arnot is a medical doctor and the former chief medical correspondent at NBC News. In Gangtok, India, Deepsikha Chettri is a medical doctor who works with the Calcutta Rescue, a charity which provides free healthcare for those in need. In Lancaster, in the UK, Derek Gatherer is a virologist and a lecturer at the Lancaster University. Welcome to the program. Bob, with this new somber milestone, what is the message? What's the feeling in the United States of America? Is it the sentiment that this could be a long way to go before a vaccine is developed?
Sure. So, Hashem, first of all, I thought you gave an incredibly empathetic and eloquent introduction to this terrible tragedy affecting so many people. I think the interesting thing is, on the one hand, there's a little optimism in that things are changing. You know, there are much better masks that will give you up to 97% protection. Mm-hmm. The vaccine is on the way here. We figured workarounds in terms of, good social distancing, better ventilation systems, businesses are getting up and going. And yet we have this tremendous dichotomy. I'm here in the Northeast, and in our state, Vermont, we have a 1% infection rate. We haven't had a death since July. It's been phenomenal because everyone really plays the game right. That is, they do the social distancing, they're wearing the mask, they're very respectful. You look at the southern part of the United States, especially states like Florida, where they really sort of flaunted not wearing a mask, not distancing, going back to the bars, going back to restaurants, and suffered 14,000 excess deaths. So what we really have is a very unstable political situation here where we know what to do, but we're not doing what we should do. But to answer your question more directly, there's great hope that things are incrementally changing. Those increments mean there's a bigger sort of boost back to life. But just this morning in the New York Times, they reported how the White House had tried to change the data that the CDC had for the risk to children to get them back to school without realizing that there are real dangers to children and that children not in large numbers, but children numbers are getting sick and dying from the virus. So tremendous political turmoil here. It's the reason that we're the #1 worst country in the world when it comes to the coronavirus.
We will go back and talk more in detail about that particular political aspect of the story. Deepsikha, the death rate in India is low compared to many countries. But when you look at the curve, it has never plateaued. It has always been going up, picking up. Is this a source of concern for you? Are you concerned that in the coming weeks we might see more mortality in India?
Yes, of course. I mean, it is a fact that the case fatality rate has been very low comparatively, but we cannot take that fact to undermine that our cases have also been growing very exponentially. So it is a matter of concern, and it should be a matter of concern, because now we are in our lockdown phase 5, I think, and with every passing day, we are opening more and more things. Public transports are being opened. Slowly, we are considering opening schools. So with every passing day, I expect the curve to rise even higher. And the low case fatality rate is, I think, it is a lot of factors. And a major factor is also because we have a major population in the age group which is less than 80, that is less than the more susceptible age group. So that is on our side. And, so all those factors also play a lot of part. So I cannot hold that as a very comforting fact and not dismiss the entire rising curve, as you said.
All right. Derek, could this be the trend, the numbers, the figures we're talking about, an indication or a prelude to the second wave that we've been talking about for quite some time?
I think that the World Health Organization estimate of 2 million dead is based on the assumption that we are about to get a second wave, which may well be as big as the first wave. And in most parts of the world, we are seeing this second wave starting to arrive. Certainly, it's most striking in Europe, but it can also be seen in the Americas as well. And as we just heard in places like India, it seems that the first wave is still on the way up and is yet to come down. So different parts of the world are proceeding at different rates. But the likelihood in the end is that we probably will have maybe another 1 million deaths before this thing is finished. Just crossing the 1 million milestone means that we have definitely had more deaths than we had in 2009 from the swine flu outbreak. Even the highest estimates of a swine flu were less than 1 million. So we've already passed that milestone. But looking further back into the 20th century, there were 2 flu pandemics, 1957, 1968, where the official death tolls were rather larger than either swine flu or COVID. In 1957, there was maybe as many as 4 million people died from Asian flu, H2N2 as it was called. And in 1968, perhaps 2.5 million, 3 million people died from Hong Kong flu, the H3N2. The interesting thing about those pandemics is that there was much less overall impact on society, much less economic, much less collateral damage, we might say, than we're seeing now with COVID. So COVID is an interesting case. It's forcing us to rethink how society organises itself and responds to these kind of crises.
Yes. And we seem to be learning by the day. Bob, if you look at the statistics from the US, we've seen the number of infections increase in some states, then come down, and we see it now picking up in some states. New York is a fascinating place to, as far as COVID-19 is concerned, particularly the last few days, and we've seen that number further spike. Could it be a warning to the political establishment, to the medical community, that the worst is yet to come in the US?
I think there's some optimism that it's somewhat under our control. That is, when you look at New York State, it was the worst city place in the United States, or 10,000 deaths, catastrophic. I think Cuomo did a very good job outside of the nursing homes. They really dialed back lots of social distancing. They went to masks and whatnot. They've been able to control it. They now don't have any spikes in Manhattan, but they're very specific neighborhoods, and they'll have strong control measures there. They have the health authorities out this morning. They're looking at masking and distancing and the way the businesses are put together. I think the most important thing, Hashem, is that, the virus has its own laws of biophysics, which are very simple. and they have changed recently. That is, one, we now believe the virus is airborne. And what that means is, we used to think it was just a droplet. A drop would come out of our mouth and 3 feet it dropped to the ground, so that, masking and a little bit of distancing seemed okay. Now, the belief, World Health Organization holds us up, CDC said it, is that it may actually stay and live in the air as viral particles. Should that be true, it means that if you're in a closed indoor space, you're at high risk. And I think that's the biggest message is don't get into those closed indoor spaces. And the other is, there's a new paper coming out of Harvard and the Broad Institute showing the phenomenon we call super spreaders. There was a case of one single individual who came from Europe to Boston in February, at least 98,000 cases from that and infecting much of the area. Now, what public health authorities are saying is, listen, we should have had very good contact case tracing. We should have had testing. We should have been on it incredibly vigorously early in February there to stem the epidemic. Once you miss it, you completely miss it. Okay. It's just out of the bag because of the super spreader phenomenon.
Deepsikha, earlier, a few months ago, we were always asking doctors about whether the ramping up of the tracing and testing capabilities were the best way to contain the stem of the virus. Now, with this new milestone, with 1 million deaths, what do you think is the biggest challenge that doctors are facing in India, for example?
See, as per the ramping up of the tests, it has been a very successful tactic in my country, because what we do is we test a certain individual, and suppose in one area a person has tested positive. We do not seal the whole state, but then that particular building or the area where the positive person is there, that particular building or locality is contained until and unless the last person in that locality tests negative. This model was initially started by the state of Kerala, which is a very exemplary and model state of my country. And then the other states followed suit. So this has, it has helped us to contain the virus to a great extent. And the challenges that we as health workers are facing is, of course, we are one of the most, I think in the next census, we will be the most populous country in the world. So we have a large number of patients, and not only COVID, we have our own endemic problems. There's the malaria season coming up now in October, dengue will set in. So we have our own other endemic zoonotic diseases to deal with. So COVID is one of the things that we have to fight. And then there is, as my predecessor Bob said, the virus has got more chances to spread in a closed space. So, India is so populated. There is more than, I think, a great portion of the population who is living in closed, cramped up places, in slums and in rural India. So, for us, even overcrowding is a very basic problem that we have to deal with. The same happens in the hospitals. Our health facilities are good, but then there is such a huge population to cater to. So that remains our biggest challenge. And also with every passing day, health workers have been testing positive. Their families have been testing positive. So of course, I think not only in India, but the whole world, health workers continue to face the brunt firsthand. And, at this point, I just want all of us to remember that we not as a country, as a world, at this point, we have enough weapons and everything to destroy the earth in one go. But we as an entire planet did not have enough medicines and health workers to counter a pandemic. So this is a big, big check for us. And I want, we should work better, and we should work more, and we should work more for what is required, more for humanity now. I think this is the time.
Derek, the conventional wisdom was that as far as test positivity rate, it should always be below 5% for any government to decide how to move forward. If it was to relax the confinement, if it was to reopen, if it was to tell people, you know what, it's safe. Derek, is that metric irrelevant now? Do we have to think about something different?
Well, what we saw in Europe was that as the first wave abated, and case numbers fell dramatically. We scarcely had hit bottom before they started to go up again. There wasn't really any flat period in Western Europe where case numbers were sustainedly low. As soon as lockdown started to be released, the virus simply took advantage of the possibility to get more hosts, and the numbers started to go back up again. Not as steeply as they did in the spring, but they started to go back up steadily, and now we're in the throes of a second wave. So it is undoubtedly the case that lockdown was a very effective method of reducing numbers, and anybody that doubted that just has to look at the data. We can't, though, however, stay in lockdown forever, because the economic consequences are too serious, and it isn't really an economy versus lives equation, a dichotomy, as some people would try to suggest, because where we have economic damage, we have social damage, and then we have collateral medical problems. We've seen increases in alcoholism, venereal diseases, unplanned pregnancies, all of that sort of thing. Mental health problems is going on, certainly in the UK. So I think that to take too much of a metrical approach to it, to say that when we reach 5%, we can unlock the community, but when we go above that, we have to start imposing lockdown measures again, it is overly simplistic. It's an extremely complex situation.
Bob, this in an ideal environment, this should have been purely medical debate about a disease and the need for a vaccine to protect people. Unfortunately, when politics jump in, this is where the lines are blurred. And in the US, where you live, you have people dismissive of the threats of COVID, you have anti-vaxxers, you have those conspiracy theorists, and you have a president who said initially you shouldn't be worried. Isn't this politically explosive and divisive landscape a detriment to moving forward and containing the spread of COVID-19?
Absolutely. It's the swaggering sort of, me first, personal freedom, hoaxers, conspiracy theorists that have cost us over 100,000 excess lives. I mean, look at a couple of examples. This morning in the New York Times again, it turns out that the White House tried to downplay the data among children, to say it was safe to go back to school, to press them back. In the state of Florida, the governor there fired the person who does the dashboard so he could say it's safe to open up, and then lost 14,000 people. So yes, terrible disinformation campaigns. The Centers for Disease Control has been the premier worldwide agency in terms of epidemiology and tracing and testing and whatnot. And it's really shamed itself, by allowing White House interference and by telling people things that weren't true. It said you don't need to test if you've been exposed to the virus. So it's been a terrible, terrible time in terms of political turmoil. And just to add, State of Kerala is an example, which I love, such an inspirational part of India there. To think that India has quadruple the population of the United States, and actually has done better. That there's a more cohesive political message. They've done very well in terms of contact case tracing. But just one last quick point, and that is, in Boston, the Boston Homeless Project there, they had an outbreak, and 900 people were infected, and it was simple contact case tracing and doing what they did in Wuhan, which is the mobile cabins, taking those in contact with the infected and isolating them, completely broke the back of the outbreak there. So the tools are there. We can win. We can't, because, as you point out, we have terrible, divisive political ideologies here in the United States, making us the #1 worst country in the world when it comes to the coronavirus.
Deepsikha, now, the preventive measures will have to continue until we develop a vaccine. In India, what is the general sentiment among the experts? Are the Indians going to find a vaccine in 2, 3, 4 months from now?
See, 2, 3, 4 months is, I'll tell you the statistics as per the various developments. We have been working in close conjunction with the Oxford School of Medicine, and their vaccine is now entering the 3rd phase of trial, which is being co-manufactured at our Serum Institute in Pune. And then there are other 3 vaccines which are indigenous to India, one being from the Bharat Biotech, and those are all now soon going to enter the 3rd phase. But then, it's very difficult to stipulate a time frame. And even after, if I do give you a time frame as well, it's, see, vaccination is not I will never say that it is the solution to this pandemic, because vaccines come with a lot of pros and cons. Number one, there is the ethical point of view. You cannot mass produce millions and trillions of vaccines for the whole world at a single go. So there's going to be a proper hierarchical method of who is going to get the vaccine first. Is it going to be the health workers? Is it going to be the architectural infrastructure of the society, the drivers, the shopkeepers? But then again, is it ethical to segregate people in a manner so that you give the first and foremost priority to only a certain segment of the people? So there is the ethical view.
I see your point.
And then again, there's a nationalization of the vaccine. There are lots of rich countries. We are one of the poorer countries with a massive population. So, of course, the rich countries are going to get the vaccines first. That is just how it works.
Going to create loads of problems. Derek, is it safe to say...
Nationalization of vaccine.
Let me go to Derek. Derek, is it safe to say that the vaccine being developed now by the Oxford University is the most promising one in the world?
I wouldn't go as far as to pick any vaccine as the most promising one out of all the ones that are being developed. There are some that are quite far along the development pipeline. Sinovac and Sputnik in China and Russia, respectively, are already effectively giving the vaccine out to the general population in parallel with phase 3 trials without any real evidence that the vaccine is efficacious. Fortunately, their phase 2 trials seem to indicate that the vaccines are safe, but we have no evidence that these vaccines work. We have to bear in mind that because the virus is so infectious, it has an Arnot, a basic reproduction number of about 3, which means it's much more infectious than influenza. And that means that in order to achieve herd immunity threshold, you've got to have a lot more people respond to the vaccine. So the usual vaccine efficaciousness threshold for regulatory approval, which is around about 50%, probably won't actually be high enough for a COVID-19 vaccine to be effective. A COVID-19 vaccine would probably have to be effective in something like 70% of individuals in order for it to produce herd immunity in the population and bring the outbreak to a safe conclusion. So that it's going to be difficult to develop a really good vaccine precisely because of the nature of the virus. It'll be harder, for instance, than is producing a flu vaccine. And that's why, for instance, a coronavirus pandemic is potentially more of a dangerous thing than a flu pandemic, where at least with flu we know how to produce vaccines. We've been making flu vaccines reliably for decades, and we can make a new flu vaccine to any new flu pandemic strain that comes along, but not necessarily coronaviruses.
Bob, in the US, the CDC and some experts are of the view that by April 2021, or summer 21, we will have the vaccine, and it could be administered by the end of 21. Is that feasible? Is that possible?
Oh, it's certainly possible. I agree. The Oxford vaccine, I like that. I like the Moderna vaccine. But keep in mind that the vaccine only has to be 50% effective to be approved. And that means there'll be some false confidence, so you'll see some spikes from it. It may be helpful in terms of people who don't get quite a sec. But, the head of the CDC said a very interesting thing. He said, the most, maybe more powerful than the vaccine is the right mask. And what he means is, the right, we call them N95 masks, but they go through a very careful screening process, and they're up to 97% effective in terms of transmitting the virus. Vaccine's only 50%. I think there are solutions right now, which is the right masking, staying out of those closed indoor spaces, contact case tracing. We don't want to make the vaccine a panacea. It's going to be another interesting tool. So I expect, by the end of this year, you'll have some. And then they'll be rolling out, of course, to healthcare providers and people in old age homes and whatnot over the course of next year.
I have less than 1 minute, and this is going to be my last question to Deepsikha and to Derek. I'll start with Deepsikha in less than 20 seconds, please. If the hunt for the vaccine takes us longer and longer, what could be the repercussions on India, for example?
I mean, I've always told everybody that vaccine is not the solution. The solution is to wear your mask, maintain your distance, and wash your hands. So I think if we continue, there's not going to be much of a difference, I think, because anyway, to get a full country vaccine coverage in India is a very far-fetched dream. So I suggest we continue. Yeah.
Derek, if the hunt continues?
In the UK here, we have 90% compliance with mask wearing, but not everybody wears their mask correctly. Often the mask is falling off the face, which means it's useless. However, we only have 18% compliance with social distancing, according to the latest figures. So it's mostly our reluctance as human beings to do without that level of close contact that naturally we seek to have. That seems to be our problem. But we do have to pay attention to wearing our mask properly and washing our hands as well. We have to take care of ourselves and think of others, I think, is basically the way forward.
I have to remind our viewers that this is something that continues to shatter lives, to torn people apart, and the hunt continues, and people are just asking the same question again and again, when life is going to be back to normal. Bob Arnot, Deepsikha Chettri, and Derek Gatherer, I really appreciate your insight. Looking forward to talking to you in the near future as the hunt for a vaccine and a better life continues. And thank you too for watching. You can see the program again anytime by visiting our website, aljazeera.com. For further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. For me, Hashem Ahelbarra, and the entire team here in Doha. Bye for now.